Getting ready for summer around here soon. Of course, with that comes the reminders to lather up. Use that sunscreen.
Yeah, we tell us that all the time, but here in Colorado, you really do need that protection year-round, every single day. We're going to talk about Melanoma Awareness Month with 9 health expert Dr. Pyle Coley, and melanoma specifically, really serious, really dangerous, deadly.
Yes, and one of the reasons that Melanoma Awareness Month is so important is because it reminds us that this very deadly skin cancer, in fact, the deadliest of the skin cancers, is highly preventable if it's caught early. In fact, there's a condition called melanoma in situ, where you just have a little mole, it hasn't invaded yet, you cut it out, and the cure rate is essentially 100%. So melanoma comes from the pigment-producing cells in our skin, which means any skin color can get melanoma, whether you're Caucasian or African American.
So talk about why Colorado is more susceptible to melanoma cases.
Yes, the highest per capita rate of skin cancer here in our beautiful sunshine state, right? And it's because we have more sunshine, and it's because we're closer to the sun. So we have less atmospheric protection because of that altitude.
Does the dry air factor in too?
And the climate, exactly. And so if you're spending more time up in the mountains where you're higher up and it's drier as well, you're getting an exponential increase in your UV exposure. And we love spending time outdoors. And, you know, SPF protects us, but it doesn't take away all the UV damage, and melanoma is directly related to the dose of UV exposure that you've had.
Yeah, when you think about sometimes you go skiing and how much sun you get.
Well, and the reflection.
Kathy has talked about her own skin cancer, but when we talk about this, like, what do you look for? Like, all of us have, you know, spots that pop up every year. You get more of them.
Right.
Old age, right?
Well, these are sunspots. These are damage to our skin that's accumulated in the DNA of our skin cells because of sun exposure, UV exposure. Not all of them are melanoma, however. So it's really important to know what the signs of it are. In medical school, they taught us this neat little mnemonic. It's called ABCDE. A stands for asymmetry. So if you have a mole that you cut in half, either this way or this way, and it's not symmetric.
Before you go too far, moles and sunspots, same thing?
They can be. Now, sunspots are just discoloration. Sometimes they can be raised. They have that stuck-on appearance, like a little flat wart. That's called an actinic keratosis, but it can certainly evolve into a melanoma, which is a skin cancer.
Right.
So, and
ABCD. I didn't mean to interrupt you. We were talking about sunspots and moles. I wanted to make sure we were straight on.
But you should check your sunspots as well to that point.
Okay.
Because just because you have something that looked benign doesn't mean it's necessarily going to stay benign. In fact, a lot of basal cell cancers can start as a benign-looking lesion and then evolve. So asymmetry. Cut it in half. If it's not symmetric on both sides, that's problematic. B is for borders. They look irregular. That's a bad sign. C is for color, lots of different colors in it. D is for diameter. If it's more than the tip of a pencil eraser, right? Those little round pencil erasers, that's a quickly growing thing. And then E is evolving. How is it changing? And using your partner here is really important, because you think about where we're exposed to the sun, especially while we're skiing or something, the back of our heads, our scalp, the back of our neck, right?
Yes,
and
ears.
Yes, and places we can't normally check ourselves. So making sure you have someone else that does look helps a lot.
I used to laugh when clothing would come with SPF. I thought, well, all clothing is SPF, and it's not. But let's talk about SPF, how you protect yourself. Creams, everything, spray on, clothing.
Right, barrier protection is so important, and SPF is also very important. So sun protection factor, at least 30. You want to apply generously, apply at least 15 minutes before you go outside and every 2 hours. So when you're skiing, one of the things you should have in your little ski suit pockets is that SPF, because it's really important to reapply it. And then using clothing, which has UPF in it, which is another barrier protection way of blocking out some of those, using hats that are wide brimmed, using eyeglasses, because there's a phenomena called ocular melanoma.
Yes.
And I unfortunately lost a friend during medical school to this, where you can get melanoma in your eyes. There's also a condition called acral melanoma, where you can get it under your fingernails or on your palms or the bottoms of your foot. And that's not related to sun exposure. You can even get it in your genitalia. So it's really important to be aware that melanoma can look different for every person. Caucasians have the usual sun-exposed melanoma, but African Americans, Indian Americans, many different types of people can get melanoma.
Be very respectful, because you know you only get that one shot. And usually all of us start late. You know, teenagers, let's get some sun. And then as we go on age a little bit, we think, I should have been a little more wise about that.
And you can't undo that damage.
Yeah.
Yeah.
Well, thanks. It's time to think about it, so pay attention to the sun.
So don't forget, you can always find your health news from Dr. Coley with Dr. Coley at 9news.com/Dr. Coley.